So we've arrived in clinic today for your pre-assessment appointment. So we've talked to you about the preparation that you might want to think about before you get here. And now today's come and this is the room, or a room similar, that you would be seen in. So as we said before, you'd have the opportunity to come and view your scans, and we'd talk you through exactly what they mean. So we talk to you about the position and the fact that when you look at it, the right hand side and the left hand side are mixed over, and show you exactly what's been found. Often that hasn't been gone through with you before.
So the sorts of questions that we might think about answering, or the sorts of information we might tell you in this clinic consultation, is what we think we can do next in terms of the management of your brain tumour. So there's various things that we can do, but coming to this clinic means that we've got an idea that we may potentially talk to you about surgery. Surgery doesn't always mean removing the tumour. It can mean a biopsy to test the type of tissue that we're using. But either way, the pros and cons, the risks and benefits of a biopsy versus surgical debulking would be discussed during this consultation.
It's very much a two-way conversation, isn't it?
Absolutely.
So some people come absolutely terrified and not wanting surgery. Sometimes we can allay those concerns and explain that actually there are risks involved, always, but we can mitigate some of those by certain techniques we use, and we make sure you see the anaesthetist if we're worried that there might be any complications. And so we try to minimise the effects that we think could happen, and also just to help you understand what an operation for you might look like. We don't expect you to make a decision here today about what you'd like to do. You'd often want to go and talk about the options with other family members, and sometimes there isn't one right answer. So we're here to help you navigate that process as well.
We always encourage you to bring a family member with you, and we always encourage family members or friends to ask questions, because I'm sure not just you as the patient yourself, your family have lots of questions too. They may have had other people come to them to say, oh, my relative had this, or I found this experimental thing online, and we can go through all of those with you. But the predominant questions around this consultation will be about the options regarding theatre and surgical management of the tumour.
If we think that surgery is a likely option for you, or you're going to go away and think about it, we might ask you to have some blood tests today. We might ask for you to have an ECG to check that your heart's working okay, and potentially a scan of your legs to check that there's no clots there.
We usually tell patients that you may be here for a couple of hours during the day to get all of those things done. So it can be quite a long day. Always good to bring a good book. And we always make sure when you leave, you've got all of our information. Some of you may have seen our leaflets here. We make sure that you know how to contact us after you've left today, because often that can be a worry. I've got to write everything down, I've got to remember, but we always make sure that there's a way of you getting back into contact with us if you have questions after the consultation. And like Vicky said, you're not signing yourself up to anything when you have this conversation, it's just a chat.
We hope that's been useful for you, and we'll give you more information on what to bring to surgery in our next clip.